What is your question? Right. So if you have read and understood, considering a clinical examination station, kindly begin.
Okay, I'll enter, I'll wash my hand. I'm Dr. Olu, one of the surgical doctors here. I would like to examine you today. Can I please confirm your name and age, please?
Yes, I'm Karen, 40 years old.
Okay, Karen. So today I will examine your back and your two legs. It will involve me looking, touching, and then asking you to do some tests. Is it okay by you?
Yes.
Okay, do you have so much pain now? Or do you want me to give you analgesics?
No,
To give you
that's
pain
all
relieving
right.
drugs? Okay, you're right.
That's
Okay. So I want you to please remove your... Okay, waitress. Okay, I want you to remove your gown, please.
Okay.
All right, thank you. Stand up for me. Can you walk to some few distance and let me see you and walk back?
Okay.
All right, thank you. Then I want you to now walk on your toes. Take like 3 steps and walk back on your heels.
Okay.
All right, thank you. So I would like to examine you at your back. Hope it's okay by you.
Yes.
Okay, so I'm just looking at your back. I'm seeing if there's any deformity, any scar there, or any other abnormality. I'm also going to examine you at your check. I want to see whether at your side, whether you are bent to one side or the other. And then I will examine you in the front. Okay, so I've examined you. Okay, so I've seen. Okay, now I want to ask you to do some movement. So as I'm moving, can you please bend forward? I'm supporting you to make sure, put your hands forward and bend to the maximum you can.
Okay.
All right, thank you. So stand up back. Then I want you to bend towards back, put your hand on your waist and bend backwards. Okay. All right, thank you. So now I want you to put your hands on your chest, across your shoulder, and put the right on the left, and then I want you to turn to your right and turn to your left. All right, thank you for doing that. So can you please lie down now?
Yes.
Okay, so I want to examine your legs now. Can you put your legs, the right leg on your chin and run it down? Do it fast.
Okay.
Then do the other one too. All right, thank you. Then I want to, you can see this cotton wool. You can you feel it?
Yes.
Can you feel it? I'm touching you. Okay, so you now close your eyes. Once I touch you, so you just mentioned that you can feel it. So I'm going to touch you at your groin, at your thigh, knee, then the inner part of your leg, the outer part of your foot, and the inner part of the foot on both sides to see. So that's why. Then I want to examine your joints now. So I'm going to move your knee and your ankle to see whether is how supple they are. Then I'm going to lift your knee at your knee up off the bed. Okay, that's fine. So I want to examine your power now. Can you please bend your right knee?
Okay.
Straighten it. Okay, fine. Then push your knee against my hand towards the bed, against the bed. So that's fine. Then straighten your knee now. Yep. The right knee. Okay, fine. Then for your ankle, can you press your foot down like you are pressing on a car pedal? Fine. Then bring your foot up. Fine. Okay, so I want to examine your big toe now. Can you also press your big toe up, then down? Okay, so that's fine. Then now I will do the same on the left side also. Then I want to examine your reflex now. So I'll examine your knee reflex. and then also examine the Achilles reflex. Then sorry, there's one test that I forgot. Sorry, stand up. I want to do one small test for you. So I'm going to look at your back. So I'm going to mark a place at your back. I'm just to measure 10 centimeter above and then 10 centimeter below. Then I want you to now bend to the maximum that you can. Then I'm going to measure the distance between these 2 points that I've marked. Okay, all right. Thank you. That's the end of the examination. So I want to wash my hands and thank you. Can I assist you to dress up?
That's okay, I'll do that. Okay. Can you summarize your examination now if you're done?
Okay, so I've examined a 40-year-old lady that on examination, I didn't notice any abnormality on the back. There is no listening and there is no scar over the spine. The range of motion of on the spine is limited, and then she also has pain. She has the reflex tone on both lower limbs are fine, but patients and plantar flex is allox, and then the sensation over the X1 on the left leg, on the left foot is also reduced, and she can't stand on she can't walk on the toes. The Schubach's test is normal. So
yes.
to complete my examination, I want to examine the hip and the knee also. Ma?
Straight leg raising test was positive or negative?
Yes, I didn't do that.
Yes, that's
I forgot.
Femoral stretch test was?
Yes, I didn't do those two.
Oh, yeah. Okay. So considering your examination, what is your provisional diagnosis?
Yes, I'll be thinking my provisional diagnosis is lumbar canal stenosis. I'll also be thinking of a possible caudal equina, but for her, there is no I didn't check for the sphincter to know whether there is sphincter incontinence. Then the other possible differential diagnosis also diabetic neuropathy.
Yes. So how would you confirm your diagnosis?
Yes, to confirm my diagnosis, I want to do a MRI imaging of the spine. Also, is a plain radiograph of the lumbosacral
First,
spine.
you'll mention X-ray because it's the common and cheap. Then MRI, yes.
Yeah. Then MRI and X-ray and MRI. Then I want to do some blood tests, fasting blood sugar. Yes. Then the glycosylated hemoglobin to rule out diabetes. I also want to do electromyography to rule out a nerve conduction study to rule out any nerve injury or nerve conduction defects.
To rule out vitamin B12 deficiency. Okay. So what are the treatment or management alternatives that you can offer this patient?
Okay. For lumbar canal stenosis, the treatment is I can offer patient conservative treatment, which involves use of analgesics, physiotherapy, and then education on low back management and physiotherapy. Then if there is no improvement, patient can also benefit from surgery, lumbar canal stenosis. If it's diabetic nephropathy, patient will be managed using multidisciplinary approach involving the endocrinologist, good glycemic control to reduce the further worsening of the neuropathy, and then also you also benefit from neuropathic pain killers.
Okay. Right. Thank you.
Madam, I have a few questions.
Yes.
First of all, this scenario looks like mechanical backache and sciatica. It is not looking the lumbar stenosis.
No,
it is a big diagnosis.
It's too much. Yes, I know. And then it's not even that. It's disc prolapse and sciatica. Because all of a sudden, patient is facing. It was like there for 5 years, but now look here. she experienced aggravated pain once serving on table. Now, when she was bending over, maybe that time she was carrying heavy things. She bent it over and it caught disc prolapsed, and that is resulted into. So the first diagnosis is wrong. Then most of the tests were jumbled up or missed. So that's why provisional diagnosis is wrong. And yes.
And then the management is also going wrong, and number
definitely.
will be minus because
treatment would also be wrong. Yes, because provisional is wrong. So at least 3 numbers are gone like this, and the test that those were missed were also lost. So yeah.
And there is no mention of diabetes, so I don't think so. Diabetic neuropathy patient has no numbness in this.
Number 4 or 5 you can mention. Maybe patient was. I have not mentioned it in the stem. Maybe patient was.
Yes,
I have not mentioned. And then patient has to, yes, because of the job, patient has to, yes, carry heavy object and then serve. So that's something she's exposed to pain every time. Yes, someone is asking a question. Yes, please.
Ma'am, I didn't understand how he asked about the sober test and Hilsin test. He said something like 10 centimeter above and behind.
Yes, you have to understand, yes, where you have to do the marking.
Yeah, I think he didn't mention it.
He did. That he did. What he did wrong was he was doing it in a hurry. He was in a hurry. So he forgot. He asked the patient to lie down, and then he asked the patient to stand up for him again and do the let him do the marking. Actually, it doesn't look good. Patient can lie down and stand up 100 times, but make sure you ask the patient to do all the standing up tests and examinations at once. And once you ask the patient to lie down, then only just focus on the lying down examinations, because it gives a bad impression. It would not deduct your marks, but it will give a bad impression. Yep.
Okay. Yeah. Thank you.
Yes, I forgot initially. That's
why.
I
know. You were in a hurry.
Hey.
You were in a hurry. So that's what happens, when things are done in a hurry, you forget.